Morning, everybody. Welcome to Bottom Line Thursday. Brad Johnson here.
Mr. Johnson, this is Chris Beyer joining you as well.
Mr. Johnson, this is Chris Bowling. Thankful to be included in your Bottom Line Thursday.
On your program. So that's great.
Hey,
it's all good.
What's the topic today?
Yeah.
We like to mix things up a little bit, keep it interesting. So, we often talk about health insurance through the eyes of the employer, right?
Right.
But I thought, let's also take a look at it from the eyes of the healthcare provider, because they're obviously a critical component to the ecosystem. And
Yes.
There was a large study that came out by a large accounting firm, Crowe, Crowe.com. You can check them out. Anyhow, they measured the claim denial rates of commercial insurers versus government payers. And why is that a big deal? Well, if you're a provider of healthcare, you want to get paid, just like all of us, right? And you don't want to have a claim get denied, because that requires a lot of backroom to have to fight that again. And here's what they found. This is just fascinating. So, and we know commercial payers pay more. When I say commercial, I mean like group insurance carriers, the carriers that our employers are going through to get their products to their employees. So they pay more than Medicare, but commercial payers were 16 times more likely to deny an inpatient hospital stay due to medical necessity compared to Medicare.
Wow.
And 12 times higher than Medicare on an outpatient claim. And
wow.
So you think about that. Think of the back room that providers have to have just to combat this not medically necessary. And we know many times those get overturned with appropriate records. And I get, I think there should be some due diligence on both sides. Hey,
Sure.
Is this legitimate expense?
Right.
Sure.
Right.
But then I'm sure there's many times a provider just feels like this is a slam dunk. I don't know why you denied this. And now we've got to provide all this paper and time. It delays care on the patient. It increases costs in the system. Just kind of fascinating. So that's our topic for today.
Yeah, I mean, you talk about how commercial payers pay more in claims costs than Medicare, but when it's, like you said, the denials, I think that they're not paying 12 times more or 16 times more for those claims.
No.
So when you start thinking about that, what provider, can't have both patient sources? They have to take government coverage. They also need to have the commercial side, but it's, like you said, it's just the administrative aspect that they're probably losing so much revenue due to that expense that it's changing the model. So, Mr. Bowen, I know this is a topic near and dear to your heart.
When we started, the VIP network here in the Quad Cities 2 years ago, 2 years before that, when we started having conversations with providers, this was one of the biggest pain points that they had. They said our non-patient facing employees have outgrown our patient facing employees because we're dealing with insurance. So, when we came up with this concept of, could you give us transparent pricing, bundled pricing? We will make this so simple. It's on a spreadsheet and we pay you in 7 days, and we'll trust you, that you're not going to slide stuff through that should not. This is why when we tell people we're saving them 30% compared to their other PPO agreements, it's because of this, because they don't have to worry about 16 times higher denial rate, and I can get paid in 7 days. And I'll be fair. Yeah, I'm so glad that you brought this up, because it just validates what we were hearing 4 years ago, and it validates why we're seeing, our network in the Quad Cities become very, very successful. So
it's interesting, but I don't see it getting any better. That's the process we're in, I guess, if you look at the general provider world right now.
So let's talk about numbers, because I think this is interesting. I'm going to dig into Brad's brain, which I've always been fascinated with. So Medicare is, let's just say 1.0, right?
Yep.
And some commercial insurance carriers are reimbursing at bad number, 180% to 250% of Medicare. that's still not making up for the 16 times higher denial rate.
Yeah.
Yeah.
And yeah, I was thinking those same lines. So if you're a business, as a provider, they run a business, and about 45% of their revenue comes in through commercial. And
Okay.
I think, to your numbers, I think those are right in the range. And even, let's just say, maybe it depends on the state, but let's say you get twice the revenue from a commercial as you would a Medicare. And
Yeah.
gosh knows that's for sure on Medicaid business, you'd get over twice the revenue. So you got almost 50% of your business pays a lot more, but you have such a high denial rate. It's probably a diversification strategy. You get paid more, but you sure have to work for it on commercial. The reason, providers aren't required to take Medicaid or Medicare or Medicaid, actually.
Right.
Yeah.
But they do, probably to offset the fact that, hey, we have to make sure we make payroll this month.
Yes.
The guarantee money's coming in. It'd be really curious, because I know we've got a lot of providers as clients as well. This might be a nice topic to just bring up with them, because they're frustrated. Who in life loves red tape? I can't stand red tape.
Right.
And so I know that this
is like the ultimate, right behind government. It's right here in the healthcare. I mean, it's like red tape all the way.
This explains to anyone wondering why I can't find a independent physician or a independent physician group. Why are they all joining health systems? They can't afford, or I shouldn't say it. It's getting harder and harder for them to afford the back rooms to try to get paid when they provide services. Now they have to have very expensive, EMR systems that require updates every year. Medical malpractice.
So they're going health systems, or they're merging in with private equity. I just saw that yesterday. Another large provider in central Illinois and in Iowa just got a huge infusion from private equity so they can continue to grow. And, they didn't want to sell per se to a bigger organization, but they needed the influx of capital to continue to probably do a lot of what this is, to make sure that they could continue to stay viable. So very interesting topic.
Yeah. Makes you wonder, kind of parting note, you think about contracts that providers strike with commercial payers. You almost wonder if they'd be willing to give a little better discount if it was with a carrier that was easier to work with.
Yeah.
Good point.
I don't know. Something to think about. So yeah, that's our topic for the day.
Well, thank you.
Thanks again, gentlemen.
Thank you.
All right.
Appreciate you guys. We'll see you.
Take care.
See you.
Bye-bye.
Bye-bye.